Hi, I'm Rob Stevens from the UCL Centre for Anaesthesia. In this short podcast, we're going to talk through some of the basics of cardiopulmonary exercise testing, or CPET, interpretation. We're going to look at a 9-panel plot and then zoom in on the top right-hand plot, plot 3 in this configuration. We're then going to look at various ways to diagnose or determine the anaerobic threshold, the V-slope method, the ventilatory equivalence, and then we'll also look at a graph showing the respiratory exchange ratio. This is a screenshot of the 9-panel plot. As you can see, clearly there are 9 panels, numbered 1 top left to 9 bottom right. The one we're going to focus on is plot 3. Here we're looking at plot 3, panel 3, which is one of the classic plots. On the x-axis we have time as the test progresses. In blue we have the VO2 and in red the VCO2 in litres per minute. The work rate here is represented in green, in watts. There are various phases of the test: rest 3 minutes, unloaded 3 minutes, then loaded when the work rate increases until the subject can go no more, and then we move into the recovery phase, the last phase. The VO2 peak is the highest VO2 reached during the test. Here it's about 1.7 litres per minute. We also have bands for the predicted VO2 peak based on age, gender and height or weight, and the predicted work rate also. Those are the blue and green bands across the screen at the top. We've placed the line of the anaerobic threshold here in light fluorescent green from another panel. Back to the 9-panel plot, we're now going to look at one of the main ways we diagnose the anaerobic threshold, which is the V-slope method. Strictly, we should call, of course, the anaerobic threshold the VO2 at the anaerobic threshold, because it is a measure of VO2. Here we have, in our configuration, panel 5, the V-slope. The V-slope is a graph of VO2 on the x-axis and on the y-axis VCO2. Here we're looking at the dots plotted that way, and they're in red on our screen. The purple dots represent the heart rate. So each red dot is an individual measurement of a VCO2 plotted against VO2. Initially, from the bottom left, the VO2 and the VCO2 both rise together equally. They go towards the line of unity, which is represented here in brown. They both rise in equal fashions initially. However, at the anaerobic threshold, extra CO2 is being made. This has come from the buffering of the H+ that accompanies the lactate. Therefore, in this graph, we can see that the VO2 and the VCO2 plot deviates from the line towards CO2, showing extra CO2 is being made. This is one of the main ways that we can diagnose when the ventilatory anaerobic threshold or lactate threshold is. It's where the VCO2 VO2 plot kicks off from the line of 1. Back to the 9-panel plot again, and we're going to look at the ventilatory equivalence for CO2 and the ventilatory equivalence for oxygen. The ventilator equivalents for oxygen and CO2 are the minute ventilation divided by the VO2, in which case that's called ventilatory equivalent for oxygen, or the minute ventilation divided by the VCO2, which is called the ventilator equivalent for CO2. As both are in litres per minute, they have no units, they're just ratios. This graph shows on the x-axis time going through the test in the same way that the plot 3, panel 3 showed. On the y-axis, we have the ventilator equivalents, the VE VCO2, the ventilator equivalent for CO2 in red, and the one for O2 in blue. We can see that in an initial exercise, before the anaerobic threshold, both ventilatory equivalents fall. We think this is because of the reduction in dead space, which has come about because of the increase in cardiac output in early exercise. However, at the anaerobic threshold, something different happens. The lines diverge. The ventilatory equivalent for CO2 stays constant, while the ventilatory equivalent for oxygen rises. This is because there's been an increase in ventilation, which has been driven purely by CO2, and so therefore these two numbers rise in a similar fashion. So when we graph their ratio, the VE to VCO2, they appear as a flat line. However, of course, the ventilatory equivalent for oxygen is different. The minute ventilation has risen to get rid of extra CO2. So if we graph the VE divided by the VO2, that line appears to rise. Back to the 9-panel plot, and we're going to look at the respiratory exchange ratio. The respiratory exchange ratio is the ratio of VCO2 divided by VO2. In health, it's normally about 0.8, which represents the balance between carbohydrate metabolism and fat metabolism. After the anaerobic threshold, the respiratory exchange ratio rises, usually to above 1, and this is because there is extra CO2 made compared to O2 consumed. Although we usually don't use this plot to identify the anaerobic threshold, it can be helpful sometimes. I hope you found this small podcast useful. Don't forget, interpreting a cardiopulmonary exercise test is much more than just extracting some information from the panels. We have to think about the clinical information, such as what drugs the patient's on, what is their history, and why are they being tested. What's their hemoglobin? Why did they stop exercising, and did they have any sort of clinical incident, such as chest pain or dysrhythmia? What was the 12-lead ECG like throughout the test? We have to then look at the panels in a sensible order and summarise that information at the bottom of our test report. Then we will give recommendations as to what should happen as a result of the cardiopulmonary exercise test to our surgical colleagues. Of course, if you want to know more, I'd suggest you get in touch with your cardiopulmonary exercise team wherever you are, and perhaps even do a test yourself.